procedure we will demonstrate is sinus imaging. The one thing we have to always remember with sinus imaging is you always have to have a horizontal beam. The reason why is we're looking for true air fluid levels. If you angle your tube while doing sinuses, you will delineate that and you will not have true air fluid levels. So some of the equipment that you may work on, your board will not angle. You need to angle the board and be able to do some of your sinus images, but I'm going to show you variations on how to do sinuses without the board angling. So we're going to start first with your lateral sinuses. First, again, remember to wipe the board in front of the patient. We're going to use a 10 by 12 lengthwise, put it in the bucket. Typically, again, a left lateral, so a left marker. Also, collimate down to 8 by 10. You don't need it to open to 10 by 12. The sinuses aren't that big. The lateral view, the central ray is going to be 1 inch posterior to the outer canthus. So here's your outer canthus. We're going to go a little bit posterior to that. Patient's in a true lateral. Again, I'm going to center up. Always tell your patient you're moving the board. Take their ear off. And there's your lateral sinuses. The next image we will do is the waters. So the waters method, you do not have to angle the board. So you just place the patient chin up on the board. We're going to switch out our image receptors because we need to change the marker because the patient is now PA. We're going to put a right marker on there. You can open your collimators slightly more for your waters. Again, remember your central ray exits the acanthon, so you're going to make sure your line is at the acanthon. I'm going to tell the patient I'm moving the board up slightly. Good. And then I will center my tube. Patient centered and straight. There is your waters. So since our tube doesn't angle, the next image we would do would be an open mouth aperi, where we would angle the board 23 degrees, meaning this board would angle, and we would put the patient's open mouth on the board. But since our board doesn't angle, we're going to modify it, and the patient's going to still be in the waters position, but they're going to open their mouth. So all we're doing is an open mouth waters. That will replace the transoral peri method. The central ray needs to exit the level of the lips. So again, I am going to have to lower the board slightly. So you're going to tell your patient the board's coming down. Right here. Okay. I'm going to move my tube. Patient straight. And there is your open mouth waters. It modifies so since we can't angle the board, we're kind of using the patient's head as that 23-degree angle so we can see the images, see what we need to see for the sinuses. The next image we would do would be a PA axial. So typically we would angle the board 15 degrees. We're not angling the tube, so we angle the board. So the patient's, you're going to start with the patient's nose and forehead on the board. But in order to get that 15-degree angle, we're going to back the patient's head off slightly, only so basically the tip of their nose is touching the board. So it's about 1 inch off of the board. So we're basically using the patient's head as that angle as opposed to using the board as the angle. Again, horizontal beam, shoot straight. Central ray would exit at the nasion. So I'll have to move the board out. I'm going to tell my patient I'm moving the board. Good. Patient straight, image receptors lengthwise, and again, a right marker would be on the image receptor. That is sinuses. I will demonstrate later on sinuses with the board angling, so you can see the difference between the two.